everyone. I'm Mrs. Princy, Associate Professor in Mental Health Nursing. Many of us have got, so many different passions, right? Some of us use dance as a passion, music as a passion, art, craft. So we have got varieties of passion which will help us to calm down, which will rejuvenate our mind, right? So we have got such kind of therapies in psychiatry known as the recreational therapies, or we can say the relaxation therapies, which is going to bring about calmness or the feeling of pleasantness in a person, right? So when there is a patient with the psychiatric problems, as a therapy we use these relaxation methods to calm down the client and to rejuvenate the client's mind as well as the emotions. One such therapy which I'm going to talk about is the music therapy. Who doesn't love music? Every person loves the music irrespective of the types of the music. We have got fast music, the soothing music, soft music, your different varieties of music which each individual will prefer based on his interest, right? So one such therapy that we use in treatment of psychiatric disorders is the music therapy. Let us see the definition of music therapy. Music therapy is the use of music and its elements with the patient or a group of people in a process destined to make the communication, learning, or expression easier and also to promote it. So you understand that music is one of the therapy that we use in psychiatric setup on the person or the group of people, which is going to improve or promote their communication skills, or it is going to promote the learning or the expression of feelings. So the music that we use for the music therapy may be a recorded music, or it can be a song, or it can be a writing of a music, or instruments that which the clients will use to play the music. So all these are included as the part in the music therapy. Another definition we have, it is an interpersonal process wherein the therapist will use the music to help the clients to improve or to maintain the health, right? So this is the definition of music therapy. Moving on to the history of the music therapy. So how did we get to know that music is going to be a very important treatment process? So earlier, if you take the Egyptians, okay, music was used, in the ancient time also. So if you take the Egyptians, they were using the music for the curative process, okay, for curing many of the mental disorders. And if you take the Greek period, they used the music for the treatment, that means for curing as well as to prevent the different illness. So you can imagine it is used since the ancient time. Egyptians used to use, the Greeks were using the music, and nowadays we use the music therapy to improve the client's physical, psychological, intellectual, as well as the social functioning of people with the health or educational problems. So we use this music therapy which is going to improve the overall well-being of an individual. It can be in terms of the psychological well-being, the physical health, the intellectual functioning, or it can be related to the social functioning. Music is going to help the individual with the health problems, with the educational problems to improve or promote the well-being of the person. Moving on to the types of music therapy. So we have got mainly two types of music therapy. One is the adaptive music therapy. The second one is the palliative music therapy. So what is this adaptive music therapy? So as the name says, adaptability, it is mainly used to help the people to adapt to to adapt to the handicap or to the disability, right? So they use the music for, it can be a mental disability or a physical disability. So it is used for those clients to adapt themselves. Okay, so that is called as adaptive music therapy. So if you take the second type, which is the palliative music therapy, it is used to treat the symptoms of the patients with physical, mental, and emotional disorders, right? So that is what is used for a palliative therapy. So it can be related to the any kind of the physical disorders. For example, it can be used in the cancer treatment, the palliative treatment in terms of cancer patients, or in terms of the mental disorders. So any kind of the anxiety disorders, sleep disorders, eating disorders. So like that, we have got a variety of the disorders, mental disorders, wherein the music therapy can be used. Or people with the emotional disturbances, okay, mood disturbances. So even in those, for example, we have the depression, right? So in all these cases, when it is used as a palliative modality, it is called as the palliative music therapy. So it can be any form of the music, but it is used at different settings, in a palliative center or in a disability center for the for the adaptability, right? So these are the types of the music therapy. Moving on to the uses of the music therapy. Number one, it is going to help the client to explore their feelings, right? So we have got so many feelings which, sometimes we feel very low, sometimes we feel very irritable, we may become angry. So it is going to help the client to explore their feelings. The second use is it's going to bring about a positive change in their mood as well as in the emotional state, right? So it is going to bring about or cope up with the variety of mood disorders or the emotional disturbances. The third use is it's going to help the individual to develop the sense of control over their lives, right? So many stressors that the individual can face in his day-to-day life. So when music is used or when the client listens to the music, it is going to help him to develop the self-control, to manage his emotions, to manage his behavior, okay, to manage his day-to-day life stressors. It is going to help him in the self-control. The next use is music therapy is going to help in learning as well as implementing skills to solve the problems, right? So many problems the individual may experience in his lifetime. Okay, to cope up with the problem, to find out the right solution to the problem, the music therapy, okay, will help in soothing the mind, as well as it brings about a relaxation wherein you can solve the problems in a easier and better way. The next use is it's going to improve the socialization, right? So music is one of the art or one of the relaxation therapy or a form of art which is going to help the socialization process, okay, which is going to bring about the communication in a particular group, or it's going to improve the interpersonal relationship, right? Say for example, where there is a client in the particular psychiatric ward, okay, who is depressed. So if a music therapy is planned for the patients, even such kind of a patient will be a part in the music therapy, which is going to make the patient to even participate in the form of singing, or in the form of playing with the music, right, musical instruments, which is going to improve the socialization process, the interaction, wherein he is going to face the group and develop the relationship and the socialization, right? So that is what is the use of the music therapy. Moving on to the benefits of music therapy. So if you take the benefits of music therapy, you got enormous benefits. So on the body, okay, on the physiological state or in the physiology of the body, how the music is going to have an impact. So various researchers have found that there is going to be a physiological change in the person when he listens to the music. So, the research has found that when the music is played, it is going to work on that, even the subconscious mind of the person. So, let us see the benefits of the music therapy. So, number one is the music and breathing. So, if you take the respiratory system or if you take the breathing, okay, how the music therapy it is going to help. When a person listens to the music, right, it is going to make his respiration very low. In a sense, the rate of respiration will be slowed or it will be decreased, and the amount of air which goes into the lungs, the inhalation or the air which goes inside will be deepened. So this process is going to bring about a calming effect on the person, and it is going to bring about emotional control and also a better body metabolism. So that is what how the respiration is going to slow down, and it is going to deepen, and also it is going to improve the overall metabolism of the person. Moving on to the next benefit, music and the blood pressure. So how is the physiology of the BP going to be controlled? So if a person listens to the music at particular fixed time period, the frequency, the particular rhythm of the music, the volume of the music. So if he is practicing to listen to the music at the right time with the correct rhythm, slow rhythm, and also the volume, it is going to help the patient create the less tension and stress, which is going to make the person's body to feel the relaxation, right? So that is how even the BP can be managed when a person listens to music. The next benefit is on the muscles, how the music and the muscles are going to how the music is going to help out in the muscle coordination. So it is found that the tone and flexibility of the muscles or the muscular system are powerfully influenced by the tone, the sound, and the vibration of the music. So, if a person listens to a particular tone or the vibration of the music, it is going to have an influence on even the muscles of the person in terms of the muscle flexibility, in terms of the muscle coordination, right? So, that is the benefit on the muscular system. Moving on to the music and temperature. So, how it is going to help in the regulation of temperature. If a person listens to a high or the noisy music, it is going to elevate the temperature of the person. Whereas if he listens to a soft and slow music, the body temperature is going to decrease or it is going to reduce. So you can see how the influence of the music is on even the temperature. So you know the temperature regulating system is the hypothalamus. So when a person listens to the music, how it is going to have an effect on the brain, how the hypothalamus is going to have an influence on regulation of the temperature. So if you take the overall benefits of the music therapy, it is going to help the person to regain the overall sense of control over their own life, right? They will be able to manage their own stressors, will be able to solve their own problems when a person is relaxed. Music therapy is going to strengthen the memory of a person. So it is one of the treatment modalities we use for the patients with the organic brain disorders, even in case of even in case of patient with amnesia or dementia, we use the music therapy repeatedly. If a person is listening to such kind of a music, it may improve the memory of the person. So overall, it is going to improve the overall mood of the person and emotions of a person, and even it is going to help out in the management of the pain even without using the medications or analgesics. The pain can be managed or it can be reduced by listening to the music. Music is going to increase the social interaction, as I told before, it's going to improve the socialization process and the relationship. Music therapy is going to even work on the communication ability of a person, right? There are many individuals who may not be, able to verbalize their feelings or verbalize their emotions. So, in a case of psychiatric patients or in case of patients with a mood disorder, depression, okay, phobias, in all those patients, they feel very much anxious or fearful to even communicate. Okay, so in those patients also, music therapy is used to improve the verbal communication as well as the non-verbal communication, wherein the person will be able to express his emotions or the feelings through the form of his behavior. Music therapy is going to stimulate the physiological changes in the person, thereby causing the relaxation. So, if you take the children, so children with the developmental disorder in terms of the intellectual ability, or in case of mentally challenged children, or any kind of a disabled child, where there is a developmental disorder of language and speech, music therapy is going to even help out such children, wherein both the hemispheres of the brain will be stimulated by the music, thereby it is going to help them to improve their communication skills in terms of language and speech. So this is about the benefits of music therapy, which is enormous, okay, which is really going to help out the clients. Moving on to the indications of music therapy, in which all conditions music therapy is indicated. Number one, it is used in variety of the psychiatric disorders. It can be from depression, or it can be to mania, or any kind of the eating disorders, sleep disorders, okay, any kind of a disorder with the substance abuse. So any kind of a psychiatric disorder, anxiety disorders, the music therapy can be used. Music therapy is indicated even in the medical conditions or the medical problems, people who are diagnosed with cancer, or people who are diagnosed with diabetes or any kind of Alzheimer's disease. Okay, so any of the medical disorder, there is no limitations, even people who are having cardiovascular disorders, right? So in those cases, the music therapy can be used. The next indication is on the physical handicap. Okay, physically challenged people, music therapy is going to help them out. Okay, it can be a blind person or a deaf, okay, person, right? So even in their music is going to bring about a feeling of encouragement, which is going to boost their. It is used in any kind of the sensory impairment, as I told you. It is used in the developmental disability. So, in children, if there is a developmental delay in terms of intellectual ability, the language, the speech, music therapy is used even in those children. People with substance abuse, any kind of the substance, it can be alcohol, various other drugs. It is used in communication disorders, people who are having interpersonal problems, as well as even in the old age, right? So even in the elderly group or the aged individuals, music therapy is going to help them out, to calm them, to reduce their stress, to divert themselves from feeling lonely or feeling depressed. So music therapy is going to even help the geriatric group. Moving on to the goals of music therapy. So, what is the goal of music therapy? Number one, it is going to increase the communication skill, right? So, the main goal here is focused on children with the developmental disorders or any people who have a communication problem. So, music therapy, the goal is to improvise or improve their communication skills. The next goal is, in the psychiatric ward, there are patients with the various psychiatric disorders. So it can be a depressed client, or it can be a aggressive client or a violent client. So when the music therapy is given in an inpatient ward, it's going to help the client to express his feelings out. Say for example, an aggressive client is given an opportunity to sing. So he will start singing because aggressive client is having a lot of energy within him. So that energy is going to constructively let it out in a positive way. Okay, he may sing a song in a very loud voice, which is going to help him to express his aggression in a constructive way. So that is one of the important goal why music therapy is used in the psychiatric setting. So even if you take a client with a even if you take a client with depression, so he may be given the opportunity to sing, wherein he may select any kind of the song which is congruent with his mood, wherein he is going to express his feeling of depression or sadness through the song, right? So like that variety of the conditions, it is going to be very much beneficial. So that is the goal of music therapy in the psychiatry. The next goal is to improve the self-esteem of the person. So it is going to boost the energy of a person, it's going to improve the confidence of a person overall. The self-esteem of an individual can be improved. So that is another goal. The next goal is to reduce the maladaptive behavior. So we have got various clients, like stereotyped behavior that they may exhibit, or they may use, compulsive behavior, the self-destructive or self-abusive behavior. So in all those cases, the music therapy is going to help out the client. The next goal of the music therapy is to increase the interaction with the others, to improve the socialization process, to improve or to increase the adaptive behavior. So when a person is in the group, okay, if you take a psychiatric setup, when a person is participating in the music therapy, it is going to help out the client to understand what are the behavior which is accepted by the group, which is going to make him to get adapted to the group behavior. He is going to learn that, is going to modify his mood according to the various situation which he comes across where the music therapy is being done. So he will be able to modify and adapt his behavior according to the various situation. Music therapy has got a goal to improve the fine and gross motor skills of a person. As I told you, how the music is going to have an effect on the muscle coordination, right? So when he listens to the music, even there is going to be an improvement in the motor skills of the person. The next goal is to improve the auditory perception. So even people who are aged, so they may have a poor hearing ability. So in those kinds of clients, okay, wherein there is a disability, there is a problem with the hearing, the music therapy is going to help them out. So these are the goals of the music therapy. Moving on to the guidelines to maximize the music therapy. So we have got some guidelines which the client will use, or which the therapist will use, so that the music therapy is going to give him the maximum effectiveness, right? So some important points that we have to keep in mind. Number one, there is not a single music which is going to help everyone. Each individual has got different tastes of music, right? The likes and dislikes of the music. Some love, fast beat music, some love, very soft soothing kind of the music. So it is not like we can generalize that we play one particular music for everybody. No. So when you do the music therapy, you have to keep in mind that each client or each person is having a different taste or different like towards the music. So we have to use the variety of the musics, when we give the music therapy. The next guideline is to wash away the stress. Taking a 20 minutes sound bath is to be encouraged. Now, what is this sound bath? So the patient or the client has to be completely immersed in the music. Okay, that is what is the sound bath is. To reduce his stress, at least he has to listen the music for minimum of 20 minutes. So you can ask the client to put on a relaxing music on a stereo, and you ask him to just sit in a comfortable position or on a couch, or you can just relax by lying down on the bed or on the floor. So he has to be near to the speakers so that he can listen to the music for a period of 20 minutes. Or else he can even use the headsets to focus the attention and avoid the distraction. So this is what is the sound bath, which is very much important, that you have to encourage the client to minimum spend a time of 20 minutes listening to a relaxed music to reduce the stress. The next important point that you have to keep in mind is always encourage the client to use a slow music, or music which has got a slow rhythm. So even the beat of the music should be lesser than the usual heart rate or the heartbeat, which is about 72 beats per minute. So a slow rhythm of the music, when a person listens to repeatedly and in a cyclic pattern, it's going to help many of the people, right? So that should be the rhythm of the music, which should be very slow, and slower than the heartbeat of a person, right? So that is another thing you have to keep in mind. The next one is, as the music is placed, you have to allow the client, or to encourage the client to allow himself to be washed in the music, which is to rinse off the stress from the day. Motivate the client to focus on his breathing, letting the breath be taken, deepen and in a slow fashion. So all this is going to reduce the stress of the particular day. And also encourage the client to concentrate on the silence, okay, in between the notes of the music, which is going to bring about a relaxation for the client. Even the silence in the music is very important, which is going to make the client to be relaxed. So that is for reducing the stress of the day. Say for example, if the client wants a stimulation of himself or stimulation of the mind after a day's work, you have to encourage the client to listen to such kind of a music which is faster rather than listening to a slow music. So when a person listens to faster beats or a faster music, it is going to bring about an energy in the person, is going to stimulate the person, right? So that kind of a music can also be used. So when the person feels very tough, okay, gets very tough or very frustrated, you can encourage the client to select the music which is very much familiar of, or any kind of a favorite music that he has, a favorite song, or any kind of a oldies, old songs which the person used to like. So he can listen to such kind of a music when he feels very tough, or when he feels very uncomfortable within himself, which is going to bring about calmness in the person. Another thing is, you can motivate the client to listen to the music via the Walkman. You can just walk, okay, and even listen to the music when he jogs or when he is going to have a walking. Along with listening to music and walking, you can even do the breathing exercises, inhaling and exhaling exercises that you can do, which is going to be a great stress reliever, because it's going to be a combination of walking, listening to music, and even breathing. So the stress relieving can be more effective when it does all three together. So another very important thing that you can even tell to reduce down the stress is listening to the sounds of the ocean, listening to the sounds of nature. It can be the ocean waves, or it can be the calmness in the deep forest, or it can be the sounds of birds. All this is going to bring about calmness in the person. So if the person is just living near the seashore, or the ocean is very near to his place of living, or he can go to a particular natural place, you can encourage the patient to spend at least about 15 to 20 minutes to take a walk near the seashore, or to go near the patch of woods, so that he can feel the calmness. Or even you can encourage the client to buy some musics or tapes which has got the sounds of the seashore, or some natural sounds. So all these also you can encourage the client to do to reduce down the stress. Right? So these are the various guidelines that you have to keep in the mind, so that you as a therapist, you can know the importance of variety or different forms of music, how it can be delivered to the client, and even you can educate the client and encourage him to use different forms or different varieties of the music, which is going to help him down to reduce the stress. Right? So moving on to the advantages of music therapy, it is going to facilitate the emotional experience or expression, wherein he is going to let out all his emotions or feelings. The second advantage is it's going to improve the cognitive function of a person in terms of learning, intellectual ability, in terms of the memory, attention span, wherein it's going to improve in all these areas. And the third thing is it's going to bring about the social interaction or the socialization process, wherein the interpersonal relationship can be improved. So these are some of the advantages. Moving on to the role of the nurse in music therapy. What is the responsibility of the nurse? Number one, you're going to help in organization of the music program for the patients and also by the patients. Okay, you have to give the opportunity for even the clients to decide in organizing the music therapy sessions, right? So you're making the clients to collect different varieties of the music, different tones of the music, rhythms of the music, so that he will be a part in organization of the music therapy program. And you being the leader, you should be there with the client to help him in the organization of the music therapy session. The second thing, you're going to encourage the client to participate in the music activities. So various activities, it can be singing, dancing, okay, the group programs, or any of the playing the particular musical instrument. So you always have to encourage the client to recognize his talents, and you have to motivate the client to involve and participate in the various musical activities. You can even have a competition when there are many clients who are very much interested towards the music and musical instruments, singing, very much enthusiastic. They have got lots of ability and talents. You can even have a competition, a healthy competition, which is going to bring about a reinforcement, a positive reinforcement for the clients. The next responsibility is you're going to observe the non-verbal expressions of the client during the music. So, music is going to have an effect on the behavior or on the mood of the client, on the thought of the client, right? So, you're going to be there with the client, observing the behavior, observing his expressions when the music is played. So, it can be a fast music or a soothing music. So, how is the behavior the client will exhibit when he listens to a variety of the music, so that it will help you in planning, and also it will help you in the treatment process as to what is best suited for the client. So if the clients feel very disturbed listening to a loud kind of a music, next time you see to it that such kind of a music is not being played when a client is there. Okay, so like that, it is going to be very much useful in the planning of the treatment, wherein you're going to observe the non-verbal expressions or behavior of the client. The next thing is you're going to provide a positive reward or a reinforcement when a client is participating in the program. It can be a token economy, or it can be any kind of a appraisal or a prize or anything, the small tokens or gifts that you can give to the client, which is going to boost his self-confidence and the esteem. All right. So these are the responsibilities of a nurse in the music therapy. So very important, music is going to have a great impact on the mind of the person, or it can be the physiology of the person itself in terms of physical, mental, social, intellectual functioning, wherein it's going to uplift the overall well-being of the person. Right? Hope you all have understood the topic. Thank you.